Hello again. In July 1945, as the war in Europe came to an end, the first general election for a decade was held in Britain. It returned a socialist government with a majority of 146, sufficient to enable it to push through a programme of nationalisation and state control such as never before been seen in this country. Coal mines, railways, gas, electricity, telephones and the medical profession were, by 1950, all enterprises run by the state with centralised control in London. This situation lasted for many years, and the longer it went on, the less efficient many services became. This is because they were effectively monopolies and without competition. They felt no particular need to change or start trying to provide better services to the public. In the 1970s and 80s, if you wanted a telephone, there was a typical waiting list, which meant you had to wait 6 months for one to be installed. All telephones were of a government-approved design. Gas cookers could only be bought from a state-run gas showroom and had to be fitted by a government gas fitter. It was like living in the Soviet Union at times. And of course, the same applied to medicine. It was a state monopoly. All those other state monopolies, relics of the socialist administration of the late 1940s, have withered away, but somehow the state-run health service has lingered on. We are told that it is the envy of the world, which makes it odd that other countries don't appear to have any desire to copy it. The truth is that even if it were not horribly overworked by the population explosion in this country caused by immigration, the NHS would still be a pretty poor model of a health service. There's no real effort to provide a service which people want, for the simple reason that for most people the NHS is the only show in town. This is why so many receptionists in health centres are horribly abrupt to the point of being discourteous or even rude. They know that patients are not really able to shop around and must put up with whatever service there is. That's why there's a mad scramble at 8 o'clock in the morning to try and grab an appointment. It's very convenient for the health centre to ration out care in that way, however frustrating it might be for us. We're treated like charity cases who ought to be grateful for any help which we receive from this service. That we have paid for it by our taxes and national insurance contributions escapes notice. If there were an alternative, most of us would eagerly leap at it, but of course for the average person there is no choice. It is a nationalised service or nothing. This is why I'm always astounded that the British maintain such a sentimental regard for the NHS and are determined to be grateful for it and to praise it to the skies. The slightest hint that the system might be changed and an element of competition introduced makes people shriek about privatisation. Let's face it, for many of us, the present system could hardly be more inefficient and unsatisfactory. Anything would be an improvement.